Officially here, of course, we know
Yes.
with the temperature. Many of you will take a well-deserved vacation.
But according to a recent national travel survey, 63% of American travelers report that they or a travel companion have become sick on vacation.
And never something you want. And joining us this morning to discuss staying healthy on your vacation, Dr. David McNamara at the Gunderson Health System. Thanks for joining us. Now, we're talking ways you get sick on vacation. Of course, there's being out in the heat, sunburn, all that stuff, but that's not really what we're talking about so much as what do you see with sort of infectious diseases that people could pick up in maybe tropical locations?
Well, so in travel clinics, certainly we help prepare patients who are traveling abroad to Africa and Asia, where they certainly have risk of things like mosquito-borne infections like malaria.
Yes, so do we see any of those sort of mosquito-borne infections as much? I know West Nile is always the one that kind of comes up this time of year, but is there anything else to watch out for in this area?
Sure. So, we certainly have a lot of us who are trying to enjoy summer vacation with our kids and have fun here locally and in the region. Certainly things like sunburn, always a risk. We have a lot of active families that really like to get outdoors and be active this time of year. We see a lot of tick-borne illnesses in this region, as well as some mosquito-borne illnesses as well.
So what should you do if I've actually seen I've seen a tick on me once the past couple of weeks. That's very prevalent now. What should you do if you think you have some symptoms of that sickness?
So we have a lot of ticks around this region, and this year's been a bad tick season. Certainly try and very gently get the tick off with some tweezers is important, and then monitor for symptoms. If you have development of like a red rash from Lyme disease, that's important to know and get seen promptly by a healthcare provider. If you start having fevers or chills, some of the other common tick-transmitted illnesses in this region can present with just a bad flu-like illness, a week or two after a tick bite, certainly in the summer.
Now, for people who are traveling overseas, what do you recommend as far as maybe vaccinations? And then do you give them advice as far as what to watch out for while they're overseas?
Sure. So we have a lot of travelers who do, all sorts of international travel, including overseas travel to the tropics. We go through malaria prevention with medication. We review and give them the required vaccines, as well as talk about and help prepare to reduce the risk of a bad traveler's diarrhea, which is also a really common thing with travel.
And that's that advice sometimes you hear, don't drink the water when you're when you're traveling to certain abroad. Locations. Dr. McNamara.
Very appropriate.
Thank you so much for joining us this morning.